This is from the Instagram platform of Marisoap's International Organization Nigeria. My name is Naomi, and I'm so excited to have you. I've had our reproductive and sexual and reproductive health expert, Dr. Onyekachi Kanu, join us right now. And in a very, very short while, I'll get to introduce him to you. But we're just trying to take this time out to have more people join the conversation, to have more people join the live video. We have about 13 people right now viewing us in less than 1 minute, and that's amazing. Thank you very much. Thank you. Thank you. Thank you. Thank you. We understand that this is a very, very crucial time for everybody in Nigeria, of course, across the world. And but I want to be very sure that we're all holding up, staying safe and staying at home. Thank you for joining our live video. Dr. Kachi, can you see me? If you can see me, just wave and say to us. Thank you for joining the live video. Can you hear me?
So much. Yes, very well.
All right,
Thank you for having me.
perfect. Please, if you're viewing the video and you can hear Dr. Kachi clearly, just give me a thumbs up. Put up a sign to let us know that you're following the conversation and that we're all fine. Thank you. All right, thank you.
Yeah, great.
So this afternoon, we'll be having a conversation that will be around COVID-19, coronavirus, of course, sex, sexual and reproductive health as well. So we'll see how we can tie all of this together into one conversation. If you have questions, as we will start the conversation and continue with this conversation, please drop your question at the comment section, and our doctor, who is already live on the other side, will get to answer your question effectively. Thank you very much for joining the conversation. Thank you. All right. Yeah. So, Dr. Kachi, are you ready?
Yeah. Let's go.
Okay. Thank you very much. Thank you. So the very first question that we have that has been sent in here, somebody is asking the question: is coronavirus a sexually transmitted infection? Is this sexually transmissible? That's the first question we have here. What do you have to say about that?
Oh yeah, great, Naomi. Thanks for having me. So I think these discussions are really important at this time, so that people get to know the risks they run, the exposures, and what to do, what to avoid, and what not to avoid.
Mm-hmm.
So largely, the question about coronavirus being sexually transmitted is, would I say, it's tricky. It has various forms. So first is that we need to understand the risk someone can be running by having sex with someone who could possibly have coronavirus. So the first that comes to mind is that, so as a baseline, studies have shown that we don't have all the studies out there already on coronavirus. Of course, it's a new virus. Yeah, but COVID-19 actually, but from studies about previous coronaviruses, they have not been shown to be present in semen, for instance. Okay. Now, but the broader picture is like this: for you to be having sex with someone in the first place, there is a high chance, if you're close enough to have sex with someone, you are largely close enough to be exposed to coronavirus through other means.
If you're close enough to have sex with someone, you are close enough to have the coronavirus.
If the person has it.
If the person has the virus.
If the person has coronavirus, you are close enough to contract it. So remember that the means of transmission of this virus is not just so droplets, and those droplets could come from saliva. There could be kissing in the process of the sexual exposure. Yeah, so that can be a compromise. Yeah, it's also likely that you touch the same surfaces.
Network. Hello, Dr. Can you hear me?
Yeah, I can hear you. I'm here with you. Can you hear me?
Yes, it looks like we're having a bit of network fluctuation on your end, but it's fine now, so you can go ahead.
All right, so good. So I was saying, so the trick around it is that, first of all, we need to understand the possible exposures. Is this a new person I just met? Is this somebody that I stay indoors with? How exposed is this individual? Is this somebody that goes to crowds? Is this somebody that is taking seriously the safety measures that WHO and everyone is propagating? So by and large, if the concern is about whether I can get it from semen, whether I can get it from all those, yeah, it might not be there, but then there are other exposures, contacts, droplets, breathing. If you're having sex, you might be breathing together and all those. So those exposures could be there. Yeah.
Okay. Thank you very much.
Yeah.
So we have somebody who just has a question on the comment section here. We'll come back to that question. Thank you very much, Catherine, for dropping that question. She's asking that there are lots of concerns on how to wear a face mask, and who should wear a face mask, and why should they wear face masks. Would you want to attend to that question now, or you want us to go ahead and then you come back to that later?
Yeah, we can come back to that later.
Okay, thank you. So somebody also has a question here, and she's asking that she wasn't using condoms with her partner before. So we want to assume here that this is a partner that she has been with before now, before the outbreak of the pandemic. And she's saying that she wasn't using condoms with this partner before now. And she's asking that should she start now? And she's asking if condoms can prevent the spread of coronavirus. That's the question. What do you have to say about that?
Yeah, okay, I agree. This is a legit concern. So the question is this: can condoms prevent coronavirus? So, well, condoms can prevent other stuff. Condoms can prevent some other sexually transmittable transmitted infections. Condoms can prevent unwanted pregnancy, but we don't have any evidence saying that condoms will prevent the spread of coronavirus. Now, the idea about, so what we have, the information we have from WHO about one of the approaches to prevent the spread of coronavirus. One, social distancing, especially when you are in an environment, of course, when social distancing is key. In China, for instance, most of the infections happen within households where people live together and are unable to practice that social distancing. So hand hygiene, respiratory hygiene, washing your hands regularly, coughing appropriately, covering your cough quite well. So those are things that we know can prevent spread of coronavirus. So condoms are very good. They prevent sexually transmitted infections with your partner. They prevent unwanted pregnancy, unplanned pregnancy. So, but for preventing coronavirus, it's minor. But then we encourage the use of condoms. Of course, at this time, we don't want people to find themselves in compromised situations where they perhaps when this is over, the person runs the risk of an unplanned pregnancy. So condom use at this time, of course, wherever possible, is also encouraged.
Okay. All right, thank you very much. And if you're just joining us, thank you so much for joining this live session with Stokes International Organization Nigeria. We have on the other side our sexual and reproductive health expert, Dr. Onyekachi Kanu. This morning or this afternoon, we're having a conversation around coronavirus, COVID-19, sex, sexual and reproductive health. So if you have any questions, you have worries about coronavirus, about sex, whether or not you should be having sex at this point, how you can protect yourself, how you can stay safe, you can as well go ahead and drop your comments, your questions at the comment section, and we'll get to treat your questions. Thank you very much. So somebody is asking here, point blank, you know, Dr. Kachi, this is a conversation that lots of people are not willing to have. One of the fears of lots of people right now at this point is the fact that, okay, coronavirus is here, people are staying safe, people are getting locked up. Should we also be having sex in the first place at this period before we'll be worried about unwanted or planned pregnancies or sexually transmitted infections? So the first question here, point blank, is it safe? Can I even have sex at all during this coronavirus outbreak?
Yes, you can have sex, please. Yes, you can have sex during this coronavirus outbreak. But then I need to add some context to this. So I want to look at it from two aspects. The first is sex with an existing partner you live with. For instance, if I live with this guy and we are able to ensure we isolate ourselves from the wider community. ensure we are not
Mm-hmm.
exposed to what is happening out there. Practice our proper hand hygiene whenever we are outside. Practice social distancing whenever we are outside. So the risk might be limited. Of course, even beyond the sex. If I live with somebody, there is a high chance if the person has it, I will also have it if I live in the same house with the person. All right, even beyond the intimacy of sex. Yeah. So then the
Mm-hmm.
key here is to understand the risks. Is to understand the risk that you run in terms of the exposure you or your partner, usually have within this period. Then the second bit
Okay.
of this question is with another partner, perhaps a new partner or an existing partner that you don't live with. So somebody you don't live with, you are not able to estimate the levels of exposure the individual has. How often does that individual stay out in public places? How is the individual compliant with things around hand washing, respiratory hygiene, social distancing, all those. So if the risk that we might run is if we are exposed to an individual who is not taking this seriously, we don't understand that, oh yeah, I need to practice social distancing. If I see someone who is coughing, I need to find a way to stay somewhat far from that individual. So those are the reasons that we run. But in terms of having sex, I live with. So even married couples could also be asking this question. So I live with my wife. Can I have sex with my wife? Yeah, of course you should. You can. People who are in relationships who feel, oh, I need to be with my boyfriend, my girlfriend. COVID doesn't say you can't have that sexual contact.
You're in a
However,
relationship, for instance, you don't live in the same house with that partner at this point. What would you advise, a couple in that situation to do?
okay, so a couple in that situation, you don't live with a partner. What I would want to do myself is to ensure. Are you with me, Naomi? Are
So
you
if
with
you're
me?
just joining us, I think we had a mix up, just a little mix up.
Okay,
Yes, I'm
so
here with you. Thank
I'll
you.
just I'll just go again. I'll just go again.
Okay.
If my partner is someone who is not very serious about, who doesn't take seriously this de-risking infection prevention measures, we have talked about social distancing, having good hand hygiene, having good respiratory hygiene. Somebody who doesn't, for instance, I have a partner who still goes to clubs, who still goes to party, who still goes to drink parlors and all that, and on a regular basis without the proper protective measures covering your nose and all that. So the person is a risk to me. Oh yeah, the person becomes a risk to me. So what I want to do is for individuals, you have a boyfriend, you have a girlfriend, you're married. The major measure we can put in place now is to ensure that you are protecting yourself quite well, and your partner
Mhm.
is doing the same quite well. Yeah, unless either of you can be exposed. Thank you. Did you hear that?
Okay.
Hello,
Looks
Naomi.
like we're having a bit of challenge from Dr. Kachi. But we will still continue. Please, if you're just joining us, you'd like to ask your questions. The conversation we're having this afternoon is around COVID-19, around sex, whether or not you should.
Yes. Yes, I
Okay, so we
am.
have
I
a bit
am.
of challenge from your end with the network a while ago. Um, so somebody is asking now. Now, this is a very crucial time, and there's a possibility that a lot of people will tend to take, seriously their sexual and reproductive health at this point. For instance, for a young lady who is locked up or locked down with her partner at this point, who was not able to do the right thing by going up to take up a contraceptive method. And, they are like would always say, pull out is not a form of contraception. And you are just banking on just that. And you're not really doing anything to protect yourself from an unplanned pregnancy at this point. What would you have to say to people who would want to let their sexual and reproductive health slide at this time just because of the coronavirus pandemic?
All right. Yeah, thank you so much. So the question is, I am my partner, and I don't have any form of contraceptive method on me. Yeah. And
Mm-hmm.
so what do I do not to get pregnant? Yeah. So
Mm-hmm.
now the idea is this. Of course, if you are not protected, you're not protected.
Mm-hmm.
There are different forms of contraceptive methods. Yeah, different forms of contraception that we can always use. You mentioned one, the one we call coitus interruptus, withdrawal. Yeah, people practice it, and some people occasionally it might work for them, but then we know that it is not foolproof. Many times
Okay.
that it will always fail. It will always fail because yes, because before you know what is happening, the lady is pregnant. So many times that will always fail. Now